So we're going to start rolling now. I'm going to work off of this screen, but you can look at that screen. And I just want to start with to talk about why did I put this together. Heart disease, blood sugars, even if you don't have diabetes, are an important connection. Blood sugars are what's damaging arteries, your heart valves, you name it. So we want to look at that carefully. You might also have prediabetes or diabetes type 2. We'll get to that. Oh, please hold your questions. This is a very tight schedule we have. Please hold your questions to the end so I can roll through this, and then I'll take your questions at the end of the talk. So I want to start this out, protecting your heart by managing your blood sugars. This is going to be about three pages here where we talk about how this works. It's cutting out? Okay. If I put it... Let's put it right up here. Is that on there? Oh, no. Uh-oh. There it is. That on the side.
Sorry.
Well, it's not a wardrobe malfunction, but it's close. Microphone. Yeah, I think it's from moving my arm. Okay, let's start again. Protecting your heart by managing blood sugar. You're going to see how important blood sugar is to the interior of your arteries, the inside of your heart valves. So the connection is important. And remember that people with diabetes are likely to have heart disease 32%. So it's not a good number for people in general with either conditions. We'll talk about both conditions. All right? The connection. Obesity, excess weight, significantly increases your risk of diabetes. Shouldn't be an argument on that. All right? It's doing damage, and you'll see why, because I get into this a lot deeper. You're intertwined, heart disease, blood sugar, it's all connected. An obese person's risk, it triples when it comes to a heart attack. So right away, that should be a wake-up call. So this is the important word. And I don't know, I'll throw this out there. I don't know if everybody's heard of the word glycation. It's not important because we're going to tell you what it is. But this is the word you want to walk away here knowing, because this is the one that clinches the deal. So glycation. When you have too much blood sugar, things go wrong in your system. There has to be a way to break it down. There has to be a way to store it. Well, now if you have too much, you're overloading the system. So there's a bunch of chemical enzymatic activity or non-enzymatic activities, chemical reactions that occur from the blood sugar molecules. They connect to different things in the body. That's where things start to break down. Don't need to get into depth on that. The important part is glycation comes from too much sugar and your body can't deal with it, and your body can't process it. And by the way, if you can't do that, it also gets stored as fat. Important part of this. So the process is sugar molecules attached to amino groups and proteins, and they form these different compounds. They call it Schiff base. It's not a word you hear too often. It's not important, but it creates something. And that something that it creates is damaging. Schiff-based products turn into these advanced glycation products. Advanced glycation products damage everything. And here's a word I personally never heard of, and that was the Amandori product. Not important, but it's a new one on me even. So glycation, everybody talks about. It's been around. Every doctor knows what it's about. Your pharmacist knows what it's about. Your diabetic specialist knows what it's about. Controlling the amount of glucose that you take in during the day, the amount of sugar, carbohydrates. So the effects of glycation. Glycation can have several negative effects on the body, including protein damage, tissue stiffening. Now that's an important one. When we say tissue stiffening, we're really talking about the inside lining of your arteries. All right, that's really important. Oxidative stress, the debris in your system that you have to get rid of, but maybe you can't because you've got a barrier, you've got glycation working against you. Healthy person gets rid of that debris, and that doesn't cause other problems. But people who are maybe overweight, who have diabetes, who already have heart disease, that's a real killer, that one. Accelerated aging, nobody likes that. Anybody who likes accelerated aging, please put up your hand. All right, nobody. Increased risk of chronic disease, nobody likes that one. Why diabetes increases the heart disease risk? Well, it can cause high blood pressure, that's inflammation inside your arteries. Oxidative stress, we talked about that. That causes inflammation, again, in the arteries and other parts of the body. Increased cholesterol and triglycerides can damage the endothelium of the arteries. And that's inflammation. Now, just because I said that, if you're a healthy person, you have elevated cholesterol, doesn't mean that's true. It's not necessarily happening. Some people are prone to that happening. And that's why we do blood studies that are much more in-depth. You want to know what your triglycerides are, sure. Total cholesterol doesn't mean a whole lot unless you have very high LDLs, and then we need to look at those LDLs and see if they're dangerous LDLs or not so dangerous. So there's LDLs and there's very low density LDLs, VLDLs. They're usually on your blood work, sometimes not. They're dangerous. LDLs by themselves, we don't know what they are until we break them down a bit. So don't panic when you see blood work until you know the full story. Where did I leave off here? Nerve damage turns into all types of pain in the feet, neuropathies. Usually people in type 2 diabetes will be developing these things. So other risks, high blood pressure, obesity, smoking and alcohol, these are all risks for developing this because they're all inflammatory to the body. So what is diabetes? Diabetes is a chronic condition. It's an inflammatory condition for most people. Type 1 diabetes, maybe 5% to 7% of the population has type 1 diabetes. That's an autoimmune condition. And it causes all kinds of problems. We aren't talking about that here. That's not where we're focused. But it's an issue. Type 2 diabetes, which are 92% of the population, causes a lot of the things we're going to talk about today in heart disease and other issues. Type 2 diabetes, possibly some people can have type 1 and type 2. I've had many lately, I don't know why, but they're showing up. So you can have both. You hope you don't have both, but you can. So what is heart disease? So heart disease, also known as cardiovascular disease, refers to a group of conditions that affects the heart and the blood vessels. By the way, the valves could be involved. It's pretty complicated. These conditions can damage the heart muscle, the valves, the arteries, can impair the heart's ability to pump blood effectively through that whole body plumbing system that we have, veins and arteries, and cause all kinds of problems. Heart disease is the leading cause of death globally. About one-third of the population worldwide suffers from heart disease. So what are the things that you hear mostly about heart disease? What are the conditions? Coronary artery disease. That's when we talk about the inflammation inside of the arteries. Congestive heart disease. That's more focused on the heart itself. Heart valve disease. You can damage valves in the heart, which is going to cause a problem in most cases. Arrhythmias, that's an electrical issue. We can also damage that if we're not careful. Endocarditis, infection of the sac enclosing the heart. This can be deadly. You have to treat endocarditis pretty quickly. If you don't, it probably is too late. Most endocarditis, it's a serious condition. I don't know how many people survive it without treatment. None of us are going to know that because they don't go to the doctor. Maybe none, I don't know. But you end up at the hospital in bad shape on a lot of antibiotics to try to get rid of whatever that infection is. So, let's talk about blood pressure for a minute because I think this is an important issue. This is 32 readings over 11 hours, like every half hour or so. And you can see it. The top line is the systolic blood pressure. The bottom line is the diastolic. And they kind of move, I don't want to say they move independently sometimes, but sometimes they also move together. It's hard to tell. When you go to the doctors and you get a blood pressure reading, you sit down, they put on the cuff, they blow up the cuff. 163, oh, you got high blood pressure. Well, if you notice, that's 140 over 81, that's high blood pressure. But because this is not sitting blood pressure, that could have been somebody walking up the steps, on a ladder, jogging, could have been anything. You got to look here, 102 over 65, that was actually a daytime reading. Does that person have high blood pressure? All right, see, one reading doesn't tell you a whole lot. Now, if you have a 210 over 105, you need to go to the hospital. But that's not typically what happens. You go to the doctor, they tell you your blood pressure is elevated, you go home, you take it yourself. Oh, it's normal. What happened? So this takes the guesswork out. This is a different way of taking blood pressure. It's a monitor, happens to be that one, and it's taking my blood pressure every half hour. So if I'm sitting and watching TV or reading or eating, my blood pressure is 102 over 65. My average blood pressure, 119 over 73. And this isn't necessarily me, by the way, but that's how you read it. And normal. Oh, lost my blanket. So that's perfectly normal. Shouldn't be treated. The 205 over 110 maybe should be treated. Something's wrong there. So you got to be careful on blood pressure readings. I saw. Did I read it? I read it this morning on blood pressure and all the mistakes that could happen with a cuff. It's kind of eye-opener. And I think I make some of those mistakes myself with a cuff. It's a very vulnerable way of taking your blood pressure. And where's the law? Assuming the equipment works correctly, which a lot of them don't, the cuff could be wearing out. It could be a lot of things. Assuming that your feet are on the ground, you're sitting upright, and you get taken 5 minutes to relax, maybe that's not quite right. Maybe your arm location isn't right. Maybe the cuff location isn't right. Maybe mentally you're not prepared to take it. So all kinds of things can interfere with it. This system is reading hemoglobin, and you're not aware of it. You don't know it's happening. That's kind of a better way of approaching it. On the other hand, most of it isn't resting. So it gives you that combination of what your blood pressure is truly like. Has to go up when you walk up the steps, and it should come down when you're sitting and relaxing. If it's not, then you've got a problem. So I'm going the wrong way. Symptoms of heart disease, people with diabetes, both or just one, chest pain, shortness of breath, fatigue, dizziness, swelling in the legs or feet. It's always something you want to go to a doctor and say, why are my ankles swollen? A lot of reasons for that. But you got to find out for sure. High blood pressure. That's one of the first signs that something might be not quite right. Heart healthy supplements. We gave you a handout that has those, I think, in it, but I just picked a couple of the big ones here. Fish oil. It does so many things. Lubricates your joints, and it's good for your skin. but it's so good for preventing strokes because it thins the blood in a very unique way in that it reduces fibrogen and how sticky fibrogen is in your system. And that's important. You don't want thick blood. Diabetics tend to have thicker blood from what I've seen in blood samples. And by the way, at least, I don't know that this is in the books, but when I see different blood lined up where they're taking blood, I see a variation in color. I see dark, purpley blood. I see light, cherry-colored blood. So I'm guessing the lighter blood, I'm pretty sure, is thinner blood. And it can come out quicker for the person that's taking your blood. So that's what we're looking at here. Fish oil does all kinds of things. And there's other oils that can be helpful that way. Coenzyme Q10. It can help your blood pressure. It can improve your cholesterol levels. And it also tends to be helpful if you've got a weak heart. It improves the contractility. And I've been reading a lot of studies on that. And I would say the studies are kind of proving that that's the case. Most cardiologists won't agree to that because they don't think there's enough studies yet. So they kind of avoid the issue. If you bring up that you take CoQ10, they say, okay, no problem, but they won't say it's doing you any good. Vitamin D. There's vitamin D and vitamin C. One is water soluble, one is fat soluble. On the fat soluble side and on vitamins in general, vitamin D is extremely important. If you're aging, if you're having health problems, vitamin D is going to help. And I just did a survey, or I looked at a lot of literature, called a couple friends of mine that are in cardiology, and we're looking at vitamin D more and more in depth. And now I see a lot of articles and studies showing where your immune system responds better when your vitamin D level is in the 70 to 80 bracket. Now, it might be a little too early for everybody to claim that, but I have to tell you, it makes sense because I see it every day here. People come in with their blood work. I haven't been sick in 2 years, and their vitamin D is over 70. You know, I can only assume from what I see that that's a good thing. And we know D is a good thing for bone density and all kinds of immune function. Very important. So D and C, they're the two kings I always think of. They start with those two, and you've got a lot covered. Red yeast rice. Basically, a statin, but a natural one. It works. And I don't see a lot of side effects. I think I had one person in 5 years who said they developed the same muscle pain they get from their statin. And that person probably shouldn't have been on red yeast rice, because if you have statin side effects, I don't think red yeast rice is a good choice. Things. Magnesium. Now this is kind of goes with vitamin C and D. Magnesium is kind of king of the mineral family. You know, minerals are separate from vitamins, and you want to think about it that way. Magnesium for the heart is just an amazing thing. The first, and you know what the crash cart is? When you roll into the emergency room and you have a heart attack, they have the crash cart. Doctors, nurses reach for injections on there and put in the portal that they put in your arm for all kinds of reasons. The first item on the crash cart, at least in my days in pharmacology, I don't think that's changed, is magnesium sulfate. That will return your heart to a normal rhythm and hopefully stop a heart attack, that type of thing. It's a very important part of mineralization, magnesium. You can take a little magnesium every day. It's probably really good for you. Again, builds bone density and all, but it's good for your heart. Folate. We hear doctors all the time sending people in for methylfolate or folate. It's a natural form of folic acid. Now, does folate work better than folic acid? I think the studies kind of say it does, and we hardly sell any folic acid anymore. It's all folate. Folate's a natural form of folic acid. Fiber. Don't underestimate fiber. Helps you lose weight. It absorbs things that aren't so good for you. Sugar, fats, it might be part of a weight loss. type of program. There are a lot of weight loss fibers, and we have them on the shelf here. Garlic. I think garlic might be underestimated. I know that there was a lot of hype over the 20 years, and suddenly we don't hear garlic. Garlic actually, there are studies that show improvement in the lining of the arteries if you take up garlic over a period of time. So don't underestimate garlic. It's got a lot of good ingredients, and it's anti-inflammatory. And that's probably why the lining of people's arteries could improve, or taking away some inflammation. Heart-healthy supplements. Over and above what I've mentioned, there are plant sterols and stanols. And you may have heard of beta-sitosterol, or you may have heard of polycosanol. These are the products we're talking about. We have them out on the shelf. These tend to protect the lining of the artery. They absorb fats before they can get into the arteries and into the system. And they also can be anti-inflammatory because of that. Eat lots of fiber, leafy green vegetables, citrus fruits, beans, grains. All those fibrous things are very good for you. Eat your vegetables. Olive oil. If you aren't, well, I do a lot of cooking. And I've cooked, and my father has owned restaurants. My grandfather was a fairly famous chef in Philadelphia. He worked at the Crystal Tea Room for 15 years at Wanamaker's. I don't call it whatever they call it now. It's Wanamaker's. And olive oil has got to be the best thing when you cook. Not only for taste, but for your health. It's amazing. Olive oil is rich in monounsaturated fatty acids, which are really good for you. It'll lower your LDL. It'll raise your HDL. Show me a drug that can do that. You might get two drugs that might do that. It's pretty hard to do it in a food base. It contains antioxidants, and this amazing word, oleocanthols. Yeah, probably the first time anybody in the room's heard this or seen this word. Maybe you do. I'm seeing it coming up now when people who are selling olive oil are throwing that word into their ad, because it is really important. Not joking when they throw it in. It's important. They do so many things with inflammation, arthritis, but mostly the heart. Very, very important. Anti-inflammatory properties. Polyphenols. I don't know if there are higher polyphenols in olive oil, but they're extremely important polyphenols. So you're getting a lot of good stuff for your heart, and for diabetes, and for inflammation in olive oil. 2 tablespoons of olive oil, I think it's the next slide. 2 tablespoons of olive oil a day. That's what the dietary guidelines are in the United States anyway. I don't know about the rest of the world. For olive oil, 2 tablespoons, that's what it is. And that could change your life in and of itself. So when I tell ladies that their skin is going to look much, much better when they have these 2 tablespoons of olive oil, they're sold. Don't even talk about their heart. You can sell it that way. But it really is an amazing thing for your heart. And I also noticed over the years that people that do this tend to lose weight. That's got to be important. So olive oil continued, all right? So we know it's the antioxidants kind of clean the damage up in our bodies, and they're anti-inflammatory. What could be more important? So olive oil, we're talking about, oh, by the way, I forgot, it has a nice base of vitamin E. It's probably the best vitamin E you could possibly take. Polyphenols, very important, and oleocanthols. So we talked about glycation as an important word. Oleocanthols, that's another word you can impress your friends with, but it's really an important word because it's everything, and it's in olive oil. I don't know what else it's in, and it probably is in other things, but not at the level of olive oil. So it'd be a hard time to match this. It'd be very difficult to match this. And your brain health. Do all kinds of things for your brain health. So that's really important. Fatty acids in general are good for your brain health. So fish is good. Butter. Fats in general are very good for brain health. Go to the next one. Olive oil, bone health. Who would have thought? I never really think about that myself. But it will improve bone health, and it can stop inflammation that actually prevents bone damage. You can damage your bone health yourself. It just doesn't happen naturally. Other benefits, it is antibacterial, antiviral. And that's why we sell olive leaf extract, because it possesses some of the same things. But olive oil could probably do it just as well. And you can improve your blood pressure and reduce your overall risk for cancer. Your LDLs, which your doctor says, oh, yours are too high. LDLs in themselves, they're fats, they're big fluffy fats. They're actually protective of cancer. I mean, a lot of studies that show that. Nobody wants to tell you because we're all pushing LDLs down. But they do protect you in many ways. In fact, LDLs, some of the cognitive studies that I read, nobody else reads, I guess, except psychiatrists and that type of thing. When you if you have extremely low LDLs, that's really not good for your brain health. So as much as, oh my gosh, your LDLs are elevated, you still got to prove that it's doing something to the body bad. In the meantime, it's doing something good. Symptoms of diabetes. I threw this in just in case. Increased thirst, frequent urination, extreme hunger, unexplained weight loss. That's strange. I always find that weird. Blurred vision, fatigue, slow healing of wounds. I see that all the time. Numbness and tingling in the hands and feet, the beginning of neuropathy, of course, which we have had a couple people with neuropathy, diabetics with neuropathy, that can't even walk through the front door to the counter. They're like this. They're in unbelievable pain. I always think they have gout when they come in because that's very painful. But neuropathies are even worse. Yeast infections. Check the nails. If you have someone in the family that's diabetic, check their nails. If you have somebody who has unexplained nail damage, yellowness, weird shape to the nail, a lot of black under the nail, like a fungus, you got to question what their blood sugar activity is and what it's about. Peeling between the toes could be athlete's foot, or it could be glycation, too much sugar in the blood, that type of thing. Okay, this is a real important slide, because if you can understand this, you can understand how to be healthy. So the gentleman on the right weighs exactly the same as the gentleman on the left. The gentleman on the right, however, has less. That's more like a 6% body fat. I don't know why they put 10 there, but they were generalizing. Certainly less than 10% body fat. The gentleman on the right, and this is also a generalization, he's probably a 60% body fat, not a 50. He's operating with a body of fat versus very low muscle. Now, he may have muscle, but because he has so much fat, it changes the ratio. That's the important thing. It's all about ratio. The gentleman on the right has almost no body fat to contend with, so a whole lot of things are off the table for him. And a lot of inflammations. The worry about heart disease, diabetes, all those things disappeared from his table. And the one on the right, when a sumo wrestler retires, since they have a sumo wrestler there, any wrestler, any athlete that has a lot of body fat like that faces all those risks. Diabetes, heart disease, and worse yet, we talk about the liver isn't taking toxins out properly and all that. The fat on your body is where toxins are stored. And every time you get hungry, and your body calls on glucose or some sugars, there's a demand. And that demand pulls calories from fat into the body. Well, it also pulls the toxins that are stored in that fat. All right? So you're damaging yourself just from the toxins that you've stored. The less guy on the right, doesn't matter if he stores toxins, we all do. Maybe we do. Some of us do. Most of us do. He didn't have a whole lot to deal with. So he can deal with it. His liver can purify it, send it out, whatever. The guy on the left, on the other hand, he's going to overload, and eventually he's going to have problems. So this is very, very important. I actually can measure this. I have a unit in the back that will measure this. And I can tell you exactly your percentage of body fat versus muscle. I can even tell you the number of calories you burn in 24 hours without eating. All right, so if I tell you you're burning 1,600 calories a day, and that'd be pretty high. You got to figure out for your height, that type of thing, how many calories can I eat before I gain weight or lose weight or maintain weight? Maybe 2,000 calories. You already burned 1,600 doing nothing in 24 hours, including not eating. Yes, including not eating. You're just laying there. That's how we measure that. Maybe 2,000 calories a day for you is actually going to lose a lot of weight, or at least half a pound a day, maybe. Depends on your size. A little tiny person, 2,000 calories a day could be a lot. A person that's 6'5", maybe that's not such a big deal. So you have to measure these things out and get a concept of where you are. So I do that, by the way, and I think we charge $20 minimum fee to do it. Good to set up an appointment to do it if you want to do that. What do we call when you have more body fat than you should, and once you go past 1/3 of your body as fat, we're talking about something called sarcopenia. It's not important that you remember that word, but that's what we call it. Doctors call it that. It's sarcopenia. Too much body fat for how you're built. You can only carry so much body fat, and it's going to take a toll. Maintaining healthy blood sugar, that type of diet. Oops. Oh, really jumped. Lean meats, vegetables, fruits, that type of thing. What's so bad about that? What you don't see on there is ice cream, candy, baked goods, that type of thing. And we're going to help you with that. Oh, it's already in your packet. We'll wait till I get to that and we'll see. Ketogenic diet. You've all heard of ketosis, ketogenic diet. For some reason, people all over the country are saying that's bad. I can't find the proof for it. You will lose, if a male that's in ketosis will lose 1 pound a day, generally. A female in ketosis can lose 0.5 pound a day. And you could lose 20 pounds, 30 pounds. You'd be amazed what you could lose on a ketogenic diet. And a lot of things could improve. Cholesterol, blood pressure. As you lose weight, you're going to improve blood pressure probably 95% of the time. So it's not a bad diet. I don't know why people think it's hard to do. If you ate steak and salad, chicken and salad, eggs, these things are all filling. You just don't eat it with bread. My daughters are always worried about their weight, and their sandwich looks like, some third world sandwich. Basically, there's never any bread with it. And for those of you who don't know, my daughter's a pretty well-known bodybuilder, and she's been in a lot of magazines and that type of thing. She keeps the ketogenic diet going pretty much all the time, and she always looks great. So something's going on, and she's extremely healthy. And I think the lowest triglyceride reading I ever saw happened to be hers, which I think was 23. That's pretty low. So it's a good thing. I'm going to just skip over that. So small changes make a big difference. Losing 10 pounds may be the difference between being a type 2 diabetic and not. I've seen that happen. The food you eat obviously are important. Also, how you eat, what you eat, when you eat. You've got to think these things out. When I eat, how do I eat? Earlier we were talking about, we eat pyramidally. Breakfast, lunch, dinner's the biggest. If you could turn that upside down, it'd be healthier. No matter what you ate, it would be healthier. Less when you're, at the end of the day, when your metabolism is slowing down, you're getting ready to sleep. Obviously, you lay in bed for a certain amount of hours, you're not burning calories very well. So don't eat a whole lot before you go to bed, and don't eat late. Exercise. You can never stop exercising. Exercise is very, very, very important. And below the waist may be the place most people over 65 should be looking. It doesn't sound good. Let me put it this way. Below the waist is where you get the weakest, and that's where you burn the most calories. So the more muscle you have below the waist, the better you're burning calories. So you should be walking on steps. You should be walking around the block, especially after each meal. You should be doing 10 to 12,000 steps a day. All right, so one of these devices, by the way, I'm not selling them, tells you that exactly. And my goal is 12,000 steps a day. Sometimes, like on a day like this, I'm probably not going to get it because I'm too busy today. But it's a weekend, so maybe I'm taking a day off. But when I work here on my regular day, I could walk 4,000 to 5,000 steps. Now, I because of my wife having a health problem, I clean the house, and I will put on, I did 4,300 steps, vacuuming and steaming the kitchen floor. 4,300 steps, that's almost 2 miles. So when you say you can't do it because you're in the house or something, you can put a lot of steps on in the house. And then I have to run up and down the steps a couple times to wash. It's a lot of exercise. So before I know it, I never left the house that day, and I think I had 5,200 steps. That's 2.5 miles, I believe. Yeah, 2.5 miles. So you can do it. It's not impossible. Oh, I want to talk about portion control. So portion control is how you lose weight, the beginning of how you lose weight. A portion is the size of your hand. I have a big hand, so I can eat more than you. That's big. That does me no good. However, I'd rather have a little hand when it comes to that. So that's what a portion is. And when I was a little kid, post World War II, we couldn't get plates, and it was even hard to get a refrigerator and a washer and all that. Nobody ever heard of a dryer at that point. So my father had this restaurant in Philadelphia, and we lived in Huntington Valley, and he would bring home plates and dishes from the restaurant supply. So for 5 years we ate on Chinese restaurant plates, the blue and white ones with the segments, right? Those segments are important. 2 vegetables, say a meat or a fish, and then what do we call them in the restaurant business? Monkey dishes. On the side might be your salad. Now that's appropriate. That's what you should be thinking. The portions are right, and it's kind of appropriate to have the salad, which you probably should eat first because it fills you up. So think about that. That's how you get ahead of this. If you're eating 2 of those plates, you're in trouble because they were big plates. All right, and very pretty. I love the blue and white. My mother wasn't so happy with it. General lifestyle. You can be a healthier lifestyle. Everybody can improve their lifestyle without becoming obsessed. walk after dinner. Don't eat cake, bread, dessert at dinner, that type of thing. Stress reduction. How important is that? Well, it's super important. You know, people that are struggling to not eat so much, you know, you can get somebody to the point that you've got a chocolate cake on the counter, a really delicious one, and you can walk by that all day long and never take a piece. That's special. That's like saying, I'm not smoking another cigarette and cold turkey. Only some people can do that. So what we do here, what I do here, is I do stress reduction. And I use biofeedback and some other techniques. And I teach you how to put yourself in a frame of mind where you can do that. So you eliminate the stress. You can't eliminate stress, but you reduce your stress, which stops all kinds of hormonal things from going wrong in your system, and eating the chocolate cake. All right? It's that simple. If I can reduce the stress, if I can get you to think more appropriately, you can lose weight. So stress reduction is important. I do a lot of it here. It's very simple. You sit down with a computer. I turn it on. There's a trainer in the software. I will add things to the system, teach you how to do it. So it's a pretty simple technique. It's usually 3 sessions, a 1-hour introductory session where we teach you everything. We do a baseline test, see what your stress levels look like, see if we can correct them. So that first appointment's an hour. It's an important hour. You learn a lot. The second hour is usually 2 weeks later, just to see if you're doing your homework correctly. It's very simple. 2 minutes a day. 2 minutes 3 times a day. Very simple training. And we can give you something on your phone now that will help you train. That looks a little like what I show you on the computer. And it's free. So that thing on your phone is a miracle. That's a piece of software that I can't believe they don't charge for it. It just teaches you exactly how to get rid of your stress. So it's very, very important. Let's move on because I'm running out of time. The paleo diet. It's okay. It looks to me like a Mediterranean diet. Maybe a little more restrictive. But meat, fish, fruits, and vegetables. I mean, isn't that my diet? Why is that a special diet? I don't know. So I've never been interested in the paleo. Salt. If you eat processed foods, you're getting too much salt. If you just use the salt shaker, you're probably not getting that much salt. Is salt so horrible? Well, it can cause inflammation if you accumulated too much salt. If you're a salt-sensitive person, yeah, probably a good idea to back down. Using too much salt in general, not a great idea. But we salt things when we cook. You don't need processed food on top of it. One serving of processed food is usually 2 times, 3 times your allotment of salt for the day, depending on the product. What do you expect? So stop doing that. Stop eating. You'll never lose weight, by the way, if you have a processed food diet. It just doesn't happen. You've got to eat fresh foods or semi-fresh foods, whatever that is. So the salt shaker is not that dangerous. What's dangerous is what's in the food that you buy. Nobody's going to tell you that because they don't want to lose money. Everybody's food is healthy and helping you. And none of that's true. All right? If they're selling you something packaged, it's not healthy food. Mediterranean diet. Another one of these diets that's how I eat. What am I going to change to get into the Mediterranean diet? Now, I get it. Some people don't eat that way. But to me, that's just sitting down at the table and eating or cooking. Maintaining healthy blood sugars. Well, of course, diet is very important. So when you try to work on blood sugars, you got to exercise. You got to try different activities. You want to mix it up. Some people do like swimming. I lived at the shore. I'm not that interested in swimming, frankly. I like the beach, but enough swimming. Did it all my life. Dancing, maybe not me, but some people like to dance. I think it's great. If you have a high-carb meal, taking that walk after that meal could be real important. Could be the difference between good and bad for you. Weight, maintaining healthy weight is so important. It is really important. But like I showed you in that one tile that I had up here, you could be pretty heavy, 250, with a 10% body fat. You're healthy. Your doctor's going to tell you you're not healthy. You're too heavy for your size. It's not true. You're very lean is healthy. Doesn't matter what you weigh. When you see some of these pro wrestlers, you say, well, they look kind of, they're really a lot of muscle. Now, after they retire, who knows what's going to happen? But they're pretty healthy. And they exercise all the time. They burn calories like crazy. They got a lot of muscle on them. I was in the St. Louis airport one day. I don't know what they call that one. And the whole WWE, or whatever they called it back then in the 70s, were getting on the same plane, I guess, or a couple of planes. And I'm standing there with my suitcase. They came down through this long hallway. They look like giants. They're massive people. Sergeant Slaughter was one of them, as a matter of fact. Anybody remember that? No, we don't have people like the WWE here. So, Sergeant Slaughter, honestly can't remember the rest, but they were just amazingly, everybody's mouth was like, is that possible? He wasn't there. But he would be massive, yes. Healthy weight and portion control. One word about portion control. I told you my grandfather worked at the Crystal Tea Room. Also worked at a country club in Huntington Valley after he retired, 1963. Comes home one day, and he only works 5 hours and comes home 5 days a week. So I said, what are you doing for them? What's going on there? And as far as I knew, the food was mediocre, nobody cared. And he said, I made him a real menu. The help can handle it after I leave, the whole thing. And he said, but I introduced portion control. What's portion control? I had no idea. Never heard that term before. But he made it pretty quick. He explained it. So he explained it kind of the way I did it. Your hand is the portion. He turned that whole menu into a portion-controlled menu. Members were, saying, we're losing weight. Don't get rid of this guy. And my grandfather's trying to walk out whenever possible because he's going to Europe or whatever. He's retired. He doesn't want to be locked to it. Before you know it, he's working 6-7 months nonstop for them. And finally, he just had to say, enough. I got to take off this summer. Boom. So it just changed everything there. And the food became a really important thing to the club. And again, I'm sitting there thinking, portion control. I never even thought of that. Of course, I just got out of high school. No, I'm still in high school. So I didn't get it. I wish I'd gone there and worked with him just to see how he did it there. I had worked with him later at my father's diner in South Philadelphia. So I did learn a lot of things, but I didn't understand portion control. When you understand it, you will lose weight. Just do it. Maintaining healthy blood sugar. Stay hydrated. Get enough sleep. Sleep is extremely important for your health. If you're not sleeping, I don't know what to tell you. Manage stress. Very, very important. Stress is whole body inflammatory. It's not a good thing. Changes your hormones in a very bad way. Damages the lining of your arteries. I would say, people say heart disease, cancer, diabetes, the three big health issues, right? Stress is probably way bigger than those. Stress is 50%, at least, affecting the population, causing these things. I always say this in my lectures if they have anything to do with stress. When I was the director of the Abington Stress Management Center. I don't know if I said that when I introduced myself. When I joined, the week I joined the practice, I was a beginner. We'll bring you in for a few days a week, that kind of thing. And they took me into they have a little library room where you could sit down and take a little break, that type of thing, and read a book or read a study or whatever. And one therapist pulls this book off the shelf, and it was called 129 Conditions Caused by Stress. They were every one of the big conditions. I said, it's not possible. So I read the book and I realized it's very possible. Stress could be piloting all your illnesses. Very possible. Even the pain in your back could be stress. Avoid smoking? Is that one you can think of? Sure. Smoking is very inflammatory. Take medicines when directed and take them appropriately. From my days in pharmacology, you can only get 50% of the population to take their drugs right at any given time. That was the statistics I knew in the 70s and 80s and 90s. It's very hard to get anybody to take anything correctly, or if it's 2 a day, they might do 1 a day. If it's 3 a day, they probably never do the third one. A lot of antibiotics were 3 a day. So one of my jobs was, how do I create an antibiotic that's once a day or twice a day? Hard to do. Keep track of your blood sugars. If you're having a problem, doctor says you get your blood work and the blood sugar is elevated, time to start tracking them, trying to figure out what's going on. Eat less. There's portion control again. The glycemic index. I can't show you what that is, but it's in your packet. It's just a lot of stuff. It's as many foods as they could put on 2 sheets of paper. I made it back and front. And their glycemic value. The glycemic value is a glycemic load. Those numbers can be different, but they express the same, we're getting to the same place. The lower those numbers are, the better. So they're done on a scale of 0, let's say, to 100. You want to eat things that are less than 60 most of the time. And by the way, most things are less than 60. A pretzel could be a 90. A piece of bread could be a 75. A bagel could be 95. Soda, easily 100. Sugar, 100. 99, whatever you want to say, not good. All right, so you'll learn how to use that glycemic index. I just pick random foods that you normally use. You'll see what's good and you'll see what's bad. So the glycemic index, every time a doctor says, oh, you have prediabetes, you have type 2 diabetes, they should be handing the patient a glycemic index so they can get on helping themselves. They should start losing weight, eating like the glycemic index kind of guides them, and exercise. And guess what? Things would probably get better. This is a good time to bring this up. If you're having blood sugar problems, they call this the A1C reducer. It really does. It's quite an amazing product. And the ingredients are just very sensible ingredients. The important things in here, biotin. We all think of biotin for hair, skin, and nails. Biotin is actually great for blood sugar control. Little zinc, chromium, and then they have one trademark product in here that really is the workhorse of this product. But these are a couple of things that are very good. Whoops. Berberine. This is a real big player. Berberine does all kinds of things to control blood sugar. It is really an important product. This is a 1 a day, but we have others out there. So this may not work for everybody. We have a phytosomal one. I can't remember what the third one is, but there must be 10 berberines out there because they work that well. Everybody wants to be in the business, and this is where you should start if you really have blood sugar problems. If you have a bad A1C, you should be using this one. If berberine doesn't work for you, we obviously have other ways to attack blood sugar. Our house glucose support has all kinds of stuff to correct blood sugar problems. High-end cinnamon. This is not cooking cinnamon. I've had several elderly people who control their blood sugars completely. In fact, I've had type 2 diabetics who don't use medication using cinnamon. Who would think? To me, it's a surprise. Why does that work? I know now why it works, but I didn't at the time. Garlic, good for everybody. By the way, vitamin D with K. That's the way to take it. K2. You're protecting the lining of your arteries. You're doing all kinds of things with vitamin K. And vitamin D, you're building your immunity. Very, very important. Just on a personal note, I've never been able to get my D above 30, 35. I've never been 40. Started taking this 6 months ago. Got my blood work, 73. Just where I wanted it. Who would have thought? So this is a really good one. 5,000 D, that's the recommended number now. 5,000 IUs of D is what everybody should be taking, according to a lot of the studies I'm reading. I communicated with a couple of physicians, friends of mine, and they're saying 5,000 IUs, vitamin D. So even they're converting. They think 400. 400 is a baby dose for babies. So things have changed. What they thought was the correct dose 20 years or 30 years ago, that's gone. We have more sophisticated ways of figuring this out now. All right, so much for the glycemic index. You have it. If you have questions, you can talk to me about it after. Risk factors for diabetes, well, I think we've gone over that pretty well. Overweight, obesity, physical inactivity, high blood pressure, high cholesterol, smoking, sedentary lifestyles, alcohol, that whole thing. Non-modifiable risks. So this is just kind of critical for a lot of people. Family history. Sometimes it's hard to fight your family history. So it means you've got to work even harder. Age. Every year you get older, you increase your risk factors for diabetes. Ethnicity, there are ethnic differences. I went to Hawaii, went to Maui, went to a clinic there, do some research, and I was shocked. It's 53% diabetes rate, and people over 30 or 35, I forget. It's been a long time since I thought about the study. There's ethnic differences, and this would be in local Hawaiians, not necessarily. Oh, by the way, the Japanese population there shares some of that pretty closely number-wise, and yet the people that come from California that become citizens there, they don't face that problem. So there's definitely a difference. American Indians, 50% diabetes rate. Weight management, it's important because you'll lower your blood pressure, you'll prevent different diabetes and other diseases. You take up a sport, you lower your cholesterol, you increase your metabolism. It's all good stuff. That's very important. Prevent heart disease. You'll feel better. Change your body shape. Who doesn't want to look better? Put your hand up if you don't want to look better. Now, again, I don't get it. To be able to have an operation, you can't have a bypass surgery until you lose 15% or something of your body weight. Think about that one. So you know you're going to be safer and happier if you do that, if you're having surgery coming up. Strategies to prevent heart disease: don't smoke, get moving, eat a healthy diet. You know what this is by now. You should know. You can have this, as I say, through email. Take steps to prevent infection. All right, that's what vitamin D may be the thing for you. Vitamin D, if you get a level high enough, you're going to avoid infections in a lot of cases. Maintaining a healthy heart. Did we just do this? Yes, there we go. Healthy heart rate. Your heart shouldn't be pounding. Men should be roughly average between 60 and 70. I think I have that here. Women 70 to 90. Generally speaking, slower heart rates show a more conditioned person, healthier person. If your heart's beating 100 or 105, let's say 110, when I jog, I beat 110. What's going on? So when I rest, I go down to 65 or something. That's what your body's supposed to do. You increase your heart rate, it goes down when you go to rest. It's really an important issue. If you're pounding away and you're sitting there, something's coming up. You need to talk to your doctor about that. Stress and heart disease. I think I talked about stress enough. You could read this on your own, but stress is a killer. It really is. Being director of a stress center, I learned so much. Why they made me director, I don't know, because after I was there a while, I realized, wow, there's a whole lot to learn here. And I did. And it's a really powerful negative thing in your life. By the way, extreme childhood stress. The impact of that in adulthood for that person, you can't even measure it. So when you put children to go through stressful things, prisoner, these wars that are going on around them, they're not faring well. Children of the German prison camp survivors, they have all kinds of problems. Even the grandchildren have problems. And there's a few studies that show that that's the case. Cardiovascular risks, I think we've covered that. Risk of cardiovascular disease. Your social isolation person can have a lot of problems. Toxic relationships. You got a boss that won't back off. They just ride you. It's not a good situation for most people. You have a marriage where maybe things aren't going well. That can be very stressful. Death in the family. What's more stressful than that? It's very stressful. So we all going to face those things, or at least the death in the family thing. That's going to happen. Friend, whatever. Very stressful. Changes your hormones. All kinds of things go wrong. Your cortisol is elevated. Women, all you need to know here is women are at more risk than men for cardiovascular disease. Reducing the heart risk, we've kind of gone over all that. Fresh air, good sleep, exercise. Like try biofeedback, stress reduction. Massage is wonderful. If you haven't tried it, you're missing something. Music. Comes out of the radio if you want. It's not that hard. It's freebie. There is such a thing as sound therapy. I don't know much about it, but it's out there. Vacations. People like vacations. I noticed that. Supplements. I've included that in there, but we talked about chromium. We talked about magnesium. And when heart and diabetes, I like magnesium glycinate. There are plenty of different magnesiums, but I think for heart, the studies kind of show us the glycinate might be the good place to start. And ours is probably as good as you're going to get. I want to hold this one and this one. So if you have diabetes and you don't know about benfotiamine, you need benfotiamine if you have any blood sugar issues, diabetes, type 2 diabetes. Benfotiamine 300 once a day. Read the studies. Very, very important. Benfotiamine is it's a fat-soluble B1. Maybe is the easiest way to say it. Might be a little more complicated than that. It's just a better B1. We don't even sell B1 anymore. I think we have one in the store. Benfotiamine is what you want to use. Alpha lipoic acid. If you're a type 2 diabetic, you've got to be using this because it's going to prevent, just like benfotiamine, it's going to prevent neuropathy and other damage, including inside the lining of your arteries. So these two are what every diabetic should be taking, these two. No matter what else you take, medication or not. And supplements for the heart, we kind of talked about already. Fish oil, magnesium, folate, D3, K2. Usually get them in the same bottle, makes life easier. Obesity and heart disease, they're totally connected. You always have to have always increases your risk. Obesity and diabetes always increases the risk. So, reducing the risk and improving the outcome. Sleep. Can't do without sleep. It's very, very important. Exercise. Get rid of blood sugar that way. It's extremely important and increases the blood circulation, keeps the blood thinner and moving. Eliminate smoking, drinking, particularly soda, alcohol. They're all high in sugars. Stress reduction. Drink enough water. Come on, it comes out of the faucet. Drink it. Very important. Positive attitude. You won't make it without that positive attitude. Just don't be grumpy. Be happy. And basically, that's all I have to say. I want to thank everybody for coming. Remember, you're going to get 10% on this